I'm about to tell you something that may shock you. It's something your doctor checks at almost every visit. Something that gets about 3 seconds of attention and then is ignored. And in those 3 seconds, life changing warnings are being missed. Warnings that can steal your independence. Warnings that can quietly damage your brain. Warnings that can decide whether you live in your own home or end up needing someone else to dress you. My name is Dr. Claire Whitmore, and after more than 20 years as a cardiologist, I've watched strong, intelligent, independent seniors lose everything. Not because they were careless, and not because they ignored their health, but because nobody taught them how to read what their own blood pressure was trying to say. Here's what usually happens. You sit down, the cuff goes on your arm, the machine beeps. 135/82. Your doctor says, looks fine. And they move on. 3 seconds. That's it. But hidden inside those two numbers are warnings that matter far more than whether your pressure is simply high or low. Warnings about whether your arteries are stiffening. Warnings about whether your heart is being starved of oxygen. Warnings about whether your kidneys are quietly failing. Warnings about whether your brain is suffering silent damage right now. None of this requires expensive tests. None of this requires special scans. It's all right there, in your blood pressure. But almost no one is taught how to look. Doctors are trained to react to one number, the top one. They focus on lowering it. They rarely calculate the gap between the numbers. They almost never check both arms. They don't look at patterns over time. They don't ask what your pressure is doing at night. And because of that, people miss warnings that could have changed everything. By the end of this video, you'll know 6 specific warning signs hidden inside your blood pressure readings. One of them has nothing to do with whether your pressure is high. Another explains why kidney failure is far more preventable than most people realize. And the final warning, the most dangerous one, is something you must check today. Because if you miss it, you may not get another warning. This is not about fear. This is not about taking more medication. This is about understanding that your body is trying to communicate something urgent and learning how to listen before it's too late. Let me tell you about Robert. Robert was 72 years old, a retired mechanical engineer. Sharp mind, loved solving problems, spent hours in his garage working on projects, fixing things, building things. For about 2 years, his blood pressure readings looked like this. The top number stayed high. The bottom number stayed low. His doctor focused only on the top number. We need to get that down, he said. One medication, then another, then another. But nobody noticed the gap between Robert's numbers. That gap, the difference between the top and the bottom, was enormous. And that gap was a warning. You see, when you're younger, your arteries are flexible. They expand when blood moves through them, then gently spring back. That elasticity protects your brain. But when arteries stiffen with age, pressure behaves very differently. The top number shoots higher, the bottom number drops lower, and the gap between them widens. That wide gap means every heartbeat is slamming pressure directly into delicate brain vessels. Robert felt fine. No pain, no warning signs. Until one afternoon, while working in his garage, his speech suddenly stopped making sense. His right side went weak. His wife found him confused and unable to speak clearly, a stroke. Robert survived, but his right arm never fully recovered. His speech remains slow and slurred. The tools in his garage still sit there, untouched. His wife once told me, It's like he's still here, but part of him is gone. And the tragedy is this: the warning had been there for years, hidden in his blood pressure readings. No one was taught to look. Let me show you the first warning. And this one is hidden in plain sight. It has nothing to do with whether your blood pressure is labeled high or normal. It's about the gap between the two numbers. This gap is called pulse pressure. You calculate it by subtracting the bottom number from the top number. That's it. And almost nobody does this. When you're younger, that gap is usually around 40 to 50 points. That tells us your arteries are flexible. They expand and recoil smoothly with each heartbeat. But when arteries stiffen with age, that gap widens. The top number climbs higher because rigid arteries can't absorb pressure. The bottom number falls lower because there's no elastic recoil to maintain flow. The result is a wide pulse pressure, and that is dangerous. Here's why. A wide pulse pressure means every heartbeat sends a powerful pressure wave straight into small, fragile blood vessels, especially in the brain. There's no cushioning anymore. Those vessels get hammered again and again, day after day. Over time, they weaken, they tear, they rupture. That's how strokes happen, often without warning. This is exactly what happened to Robert. His pulse pressure had been wide for years. No symptoms, no pain, just quiet damage building with every heartbeat. And when the vessel finally gave way, the damage was permanent. Here's what you need to know. If your pulse pressure is over the 60, that's concerning. Over 70s, that's dangerous. Over 80, your stroke risk rises sharply. This isn't opinion. This is supported by decades of research. Older adults with wide pulse pressure have dramatically higher rates of stroke, heart failure, kidney damage, and cognitive decline. And yet this warning is missed every day because doctors are trained to look at each number separately, not the relationship between them. Now, here's the most important part. A wide pulse pressure doesn't mean take more medication. In fact, simply forcing the top number down without addressing arterial stiffness can make things worse. The real issue is loss of arterial flexibility. That's why treating this warning requires a different approach. One focused on restoring elasticity, supporting nitric oxide production, correcting mineral balance, and reducing vascular inflammation. But before we talk about solutions, you need to understand the next warning because it contradicts everything you've been told about blood pressure. This warning surprises almost everyone because you've been told your whole life that lower blood pressure is always better. It's not. In fact, when the Phe bottom number drops too low, your heart can be quietly starving, and you won't feel a thing. Let me explain. The bottom number, called diastolic pressure, is the pressure in your arteries between heartbeats. That resting phase is not downtime. That is the only time. Blood flows into your coronary arteries, the vessels that feed oxygen directly to your heart muscle. Your heart does not only get its oxygen when it contracts, it gets oxygen when it relaxes. So if your diastolic pressure is too low, blood simply cannot flow into those arteries properly. Low pressure means low flow, and when the heart doesn't get enough oxygen, it begins to suffer. Silently, no chest pain, no warning, no dramatic symptoms, just slow, progressive damage. This is called silent ischemia, and it is far more common than most people realize. Let me tell you about Helen. Helen was 76, retired teacher, active, independent. She had been on blood pressure medications for years. Each time her top number crept up, another pill was added. Eventually, her readings looked like this: 145/55. Her doctor was pleased. "Your pressure looks great," he told her. But that 55 on terrified me. For 3 years, Helen's heart had been operating with inadequate blood flow. 3 years of oxygen starvation, 3 years of cumulative damage. Then one morning, while making breakfast, she felt crushing pressure in her chest. She collapsed. Massive heart attack. When we looked at her coronary arteries, they weren't even severely blocked. In another person, those arteries would have been enough, but with a chronically low diastolic pressure, her heart simply couldn't get what it needed. The damage was permanent. She survived, but her stamina never returned. The garden she loved became exhausting. Short walks felt overwhelming, all because no one noticed that her bottom number was high too low. Here's what the research shows. When diastolic pressure stays below 60, heart attack risk rises sharply. Below 55, the risk increases dramatically, and this happens most often in people taking multiple blood pressure medications. Doctors focus on lowering the top number and accidentally push the bottom number into dangerous territory. If you are on blood pressure medication and your diastolic is consistently under 60, this is not good control. It's a warning. Your heart may be paying the price. This does not mean you should stop medication on your own. It means your treatment may need adjustment. Protecting your heart requires balance, not just lower numbers. Now here's why this warning matters so much. Because when doctors miss it, they often create new damage while trying to prevent old damage. And that brings us directly to warning number 3, the one that reveals kidney failure long before symptoms appear. This warning makes people angry because once you understand it, you realize how many people lose their kidneys for no reason. Let me be very clear. If your blood pressure was stable for years and suddenly becomes impossible to control, this is not what just getting older, and it is not just resistant hypertension. It is a signal something serious is wrong, and time matters. Let me explain. What suddenly uncontrollable really means, this is the pattern. You were controlled on one medication, same dose, same routine, same life. Then over weeks or months, numbers rise. Medications are increased, a second pill is added, then a third, still high, still climbing. And nobody asks, why? They just keep adding pills. That is a mistake. Thomas's story. Thomas was 69. For 15 years, his blood pressure was perfect. One pill, one dose, one routine. Then over 3 months, everything changed. 140 over 85, then 155 over 92, then 165 over 98. His doctor increased the dose. No effect. Added a second medication, temporary drop, then higher again. Added a third. Still rising. 180 over 106. 5 medications later, nothing worked. This was not resistant hypertension. This was a cry for help. What his blood pressure was really saying. Your kidneys control blood pressure more than almost any other organ. Each kidney has a main artery supplying it. When that artery narrows from plaque, scarring, or compression, the kidney panics. It thinks your body is in shock. So it releases powerful hormones that tighten blood vessels everywhere, force your body to retain salt and water, drive blood pressure higher and higher. The kidney is trying to save itself, but it's destroying the rest of you in the process. This creates a vicious cycle. High pressure damages the kidney. Damaged kidney releases more hormones, pressure rises even more, and no pill fixes the cause. What happened to Thomas? 6 months passed before anyone looked deeper. By then, his right kidney had shrunk, scarred, barely functioning. The damage was permanent. If the problem had been found earlier, the artery could have been opened. The kidney could have been saved. Now Thomas faces progressive kidney failure. Dialysis is likely 3 times a week, hours at a time. Loss of independence, all because the warning was missed. The Bauer sectures, this warning applies to you if your blood pressure was controlled, then suddenly isn't. Medications that used to work no longer do. Doses keep increasing with little effect. Numbers rise fast over months. That is not normal aging. That is pathology. And kidneys aren't the only cause. Sudden uncontrollable pressure can also mean adrenal gland tumors, severe sleep apnea, hormone disorders, advanced vascular disease. All fixable if found early, but not if ignored. The rule you must remember: stable, suddenly unstable. Investigate immediately. Do not accept, we'll just add another pill. Ask, what changed? What are we missing? Have my kidneys been checked? Because uncontrolled pressure is not the disease. It's the symptom. This warning is one of the most dangerous because almost nobody is checking for it. And if you miss it, damage is already happening while you sleep. What should happen at night? When you fall asleep, your body is supposed to rest. Your blood pressure should drop naturally by about 10 to 20%. Wait, this is called slumber nighttime dipping. It gives your heart, brain, kidneys, and blood vessels a recovery window every night. If that dip does not happen, your organs never get a break. They are under pressure 24 hours a day. The dangerous patterns. There are 3 abnormal nighttime patterns. No dipping. Pressure stays the same. Reverse dipping. Pressure rises at night. Extreme dipping. Pressure drops too low. All 3 are dangerous, but reverse dipping is the most lethal. Margaret's story. Margaret was 71. Her daytime numbers looked perfect. Morning, 128/80. Evening, 132/82. Her doctor was happy, but Margaret felt awful. She was exhausted, woke up unrefreshed, went to the bathroom 4 or 5 times every night. Her doctor said it was just aging. It wasn't. I ordered a 24-hour blood pressure monitor. The results were shocking. At night, her blood pressure was higher than during the day. 165/98 while she slept. This is reverse dipping, and it almost always means metabolic stress. What was really happening? We checked deeper. Standard blood sugar tests looked okay, but when we used continuous monitoring, the truth appeared. Her blood sugar was spiking at night. Hidden diabetes, undetected, while she slept. High blood sugar activates stress hormones. Those hormones keep blood pressure elevated. Her kidneys were forced to dump excess sugar into urine. That's why she woke up constantly to urinate. Her body was under attack every night and no one noticed. Why this is so dangerous. People who do not dip at night have 3 times higher stroke risk, faster kidney failure, higher dementia risk, higher mortality, because their blood vessels never rest. Pressure never releases. Damage accumulates faster. This warning applies to you if you wake up tired every morning, you urinate multiple times at night, you feel worse in the morning than evening, you have diabetes or prediabetes, you snore, or have sleep apnea, you need nighttime evaluation. What to do? Ask for 24-hour blood pressure monitoring, deeper glucose testing if symptoms exist. This is not optional if warning signs are present. Nighttime blood pressure predicts outcomes better than daytime readings. This warning is silent. No pain, no obvious symptoms, but it is one of the strongest predictors of dementia. Dardier. What healthy blood pressure looks like. Healthy blood pressure moves gently. Up with activity, down with rest. The numbers change, but within a narrow range. Your body adjusts smoothly. What dangerous variability looks like. This is the pattern that should alarm you. One morning, 110/65. Same day, 180/100. Next day, 120/70. Day after, 175/95. These are not normal fluctuations. This is blood pressure variability, and it is toxic to the brain. Richard's story. Richard was 74, retired architect, loved numbers and tracking data. He checked his blood pressure 3 times a day and logged everything. His readings were chaos. Low one moment, extremely high the next. Doctors kept adjusting medications, but nothing stabilized him. We found the real problem. His autonomic nervous system was failing. Why this destroys the brain? Your brain depends on stable blood flow. When pressure swings violently, small brain vessels tear. Tiny leaks occur. Microscopic strokes happen. Well, don't feel them. No collapse, no dramatic event, but they accumulate. Hundreds of tiny injuries over years. This is how dementia develops. The science is clear. A long-term study following thousands of adults found high blood pressure variability increased dementia risk more than high average pressure, not the number. The HAM. Instability. Warning signs of dangerous variability. Dizziness when standing. Feeling faint after meals. Sudden spikes with stress. Large day-to-day swings. Inconsistent readings despite medication. These are not benign. Common causes: nerve damage from diabetes, sleep apnea, dehydration, anxiety disorders, improper medication timing, autonomic dysfunction. These must be identified and treated. What you should do: check your pressure at the same times daily for 2 weeks. If your top number swings more than 20 points, concerning more than 30 points, dangerous. You need evaluation because your brain is paying the price every single day. This is the most important warning of all because this one doesn't give you years. It doesn't give you months. Sometimes it gives you days hide and almost nobody checks it. Or the mistake almost everyone makes. Most people check blood pressure on one arm only. Same arm, same routine. Every time, that feels logical. It's also dangerous because a difference between arms is one of the strongest predictors of stroke, heart attack, sudden death, and it's hiding in plain sight. Dorothy's story. Dorothy was 73. She checked her blood pressure every morning. Left arm, 125/78, perfect. She felt healthy. Then she changed doctors. The new doctor did something simple. She checked both arms. Left arm, 125/78. Right arm, 180/105. A difference of more than 50 points. That is not normal. That is an emergency. What that difference really means: when one arm reads much higher than the other, it means blood flow is blocked on one side, usually from severe plaque buildup. And here's the terrifying part: if one artery is that blocked, Others almost always are too. Brain arteries, heart arteries, kidney arteries. This is advanced vascular disease, often without symptoms. Art your son. What we found. Imaging showed severe blockage in the artery to her right arm, critical narrowing in the artery to her brain. She was walking around with a stroke waiting to happen. She had surgery. She survived, but only because someone checked both arms. The science behind this. A large study published in The Lancet followed tens of thousands of people. Those with an arm difference greater than 10 points, great increased risk, 15 points, high risk, 20 points, extreme risk. They had dramatically higher rates of stroke and cardiovascular death. Jakarhi, this warning applies to you if you've never checked both arms, you always use the same arm, you have vascular disease, diabetes, or smoking history. This is not optional. Here, what you must do today. After this video ends. 1. Sit quietly for 5 minutes. 2. Check your blood pressure on both arms. 3. Compare the top numbers. If the difference is over 10 points, call your doctor. Over 15 points, call today. Over 20 points, go to the emergency room. Do not wait. Do not monitor it. Act. Putting all 6 warnings together. Your blood pressure is not just a number, it is a diagnostic language. And it's telling you 6 things. 1. Wide pulse pressure. Your arteries are stiff. 2. Low bottom number. Your heart is starving. 3. Sudden resistance. Kidneys or hormones are failing. No nighttime dip free. Hidden metabolic damage. 5. Wild swings. Silent strokes destroying your brain. 6. Arm difference. Advanced disease needing immediate care. Every one of these could be found at home for free if you know what to look for. Your action plan. Use an upper arm cuff. Measure morning and evening. Calculate the gap. Track patterns. Check both arms weekly. Bring logs to your doctor. Ask questions. Do not let anyone dismiss these warnings. Final thought. I have seen too many people lose their independence, their memory, their ability to speak, their ability to walk, not because medicine failed, but because signals were ignored. Your blood pressure is speaking. Now you know how to listen. If this helped you, share it with someone you care about. Subscribe for the next video where I'll show you what actually reverses arterial damage instead of just lowering numbers. Take care of yourself.